Good afternoon. For those of you who might not know me, my name is Ann Vaughn. I have the pleasure of serving as the President and CEO of the Byrnes Health Education Center. You get a double bang for your buck today because our founder, Susie Byrnes, is sitting right here at the front table. The presentation today is all about collaboration and how several initiatives and many people have joined to craft a response to the heroin epidemic that is ravaging not only our community, but our nation. So this is how this collaboration started. In late 2014, there was a York County Heroin Task Force Forum that was being held just across the street from our center at Crispus Attucks. Coroner Pam Gay, in her remarks that evening, lamented that there was not a preventative education piece to add to the task force, and that absolutely caught my attention. So I invited Pam to come visit the center so that we could tell her about all the health education programming that we do, especially focusing on anything to do with alcohol and substance abuse. To her credit, she responded and came right away, and she brought her first deputy, Claude Stately, and then she introduced us to Dave Sunday. And that led to the center joining the Heroin Task Force. It seemed that our center was able to provide that preventive education piece that was needed. A hallmark of our center has always been the rapid response to health needs of our community. And so our new program, Heroin the Wake Up Call, was born. This all evolved in less than a year, showing that a lot can happen when there's a need and an entire community that wants to join forces to really make a difference. I would like to publicly thank 3 of our partners in this collaboration who are our funding partners. I would like to recognize Victoria Connor, Executive Director of the York County Bar Foundation, for her leadership in funding. Brian Tate, I see you here. Lisa Levin and Jane Conover from the York County Community Foundation for their investment, as well as the DA's office for their help in taking care of making sure that this program can be immediately accessible to all the schools in York County who need and want that program. Now it's up to Pam and Dave and Jamie Reisinger to share their perspectives about this collaboration. Thank you.
Thank you. We appreciate this invitation.
Just take a few moments to talk a little bit about the program that we have developed and the work that we are doing. When I started with the Byrnes Center 13 years ago, the type of program that we were asked to deliver to students, not only in York County but surrounding counties, had a lot to do with nutrition, physical fitness. When people think health, they think nutrition and physical fitness. And over the years, we have seen a shift in the types of programs and subjects that schools are asking for. Character, education, bullying, mental health. And here we are today talking about heroin. I've been in the education field for 20 years, and I never ever thought that I would be delivering presentations about heroin to 12 and 13-year-olds. But that is our reality, and that is what we are doing. York County Heroin Task Force is doing great things. And when we heard the opportunity to join and partner and be the education piece, we thought it was a great partnership. The Byrnes Health Education Center, as you know, has been here for 20 years. We've started those relationships with schools. We've maintained those relationships with schools where there is a trust in the program that we bring, and we bring it at a high quality. And we're proud to do that. But now we have new challenges. And as we talk about heroin, listen, we don't have enough time to get into all the issues surrounding this subject. There are many, it's a complex issue. And I'm sure Pam and Dave would agree with that. There are many angles to take when addressing this problem. Some say tougher laws. Some say, tougher sentencing. Some say treatment and funding for treatment. Some say fix the prescription drug problem. And then others will say education. The Byrnes Center has always been prevention-based from year one. We feel knowledge is power. And the more you have upstairs, the more knowledge you have, the better decisions you make. And that's what we're attempting to do with this problem. We may not reach every student. Sometimes the impact of our program, sometimes we'll never know. If we say something, we plant a seed, and that student, when faced with a decision, thinks, is this the best choice? If one student decides not to use based on something we said or something they heard, then we did a good job. We made a difference. Now I hope it's more than one. When we teach a classroom, in my mind, I divide that room into thirds. And I say to myself, a third of this class are students who may never use, will never use, are typically make good choices, not tempted, and will never use. Another third, maybe it doesn't matter what we say or someone else says, maybe we won't reach them. Where I really try to focus is that middle of the road student. That student who's riding the fence. Maybe I should try this, but maybe something we say steers that student not to use or to make that better. That's our goal. And because I don't always know who's in what section or who's in what third, I try to reach all of them. We try to reach all of them. And our staff try to reach all of them. The program itself is an hour presentation. When we were trying to decide what is the most important pieces of this subject, if I took a survey, I might get many different answers. What do we say to a 13 or 14-year-old about heroin? And you have 45 minutes, you have a class period, you have an hour to do it. What do you focus on? We could talk for hours for this subject. We know that we need to change the perception that prescription drugs are safe. And that is a challenge we all have. It's prescribed by a doctor, it's in our home, right? How do we change that perception? What are opiates? Part of the program is really starting to educate students on the prescription drug problem, especially the painkillers, because we know that's the gateway to heroin use. So part of the program, we're going to talk about that. We're going to educate them. We're going to connect the dots to the abuse of the painkillers and how that leads to heroin use. They need to know how their body works in the first place. They need to know how their nervous system, how their brain, how that works in the first place before they start to understand what drugs do to their brain, their underdeveloped brain. So we need to give them a brief nervous system lesson. We talk about what the drug can do and will do to their health. Yeah, their health. The most important thing they have going for them is their health. But not only their health, we do try to point out what the drug does to their family. It doesn't impact just you. It impacts the people around you and the people that care about you. How does it impact your community? How's it impact, your friends, right? We also want to teach them about new trends. Good Samaritan law, You witnessed an overdose. You're with a friend, someone is overdosing, their lips are turning blue. Their fingertips are blue. What do? Do you run? Do you get out of there? All right. Or do you call for help? So we're going to talk about that, how to take care of a friend, what to do. What resources are available to you to get help? And we're going to connect those dots, and we're going to talk about that. What the center does well is that we we've developed these relationships with schools so that when we do have something new, when we do have something relevant, we're not just calling them saying, let us in. They're calling us saying, what do you have? Can you develop something like this? They want to hear what we have. And when we have a program like this, they're listening. We rolled out this program in December, and Amanda, I believe we contacted 170 schools regarding this. And within the first week, we had 11 school districts calling us, signing up, and getting more information about the program. I hope a year from now that number is 50, 100. Because we didn't get into the heroin problem overnight. It took years to get into this, and it's going to take a long time to get out. And one piece of this is the education piece. And again, we're prevention-based, and we hope that by getting the information out there, that they're able to think, they're able to understand, they're able to support and help one another. And hopefully at some point we're going to see change, not only in York County, but statewide. If anyone is interested in learning more about the program, I believe there's information here, or you can contact the Byrnes Center, and I can certainly go into a lot more detail. I don't want to go over my time limit here today, so that's all I have. Thank you. Okay.